This podcast is certified fresh. Freshmediaworks.com.
Welcome to the Montgomery ISD Athletics Show, where each week we share conversations about everything that makes MISD athletics so great. Montgomery ISD, in partnership with families and community, will graduate all students with the knowledge, skills, and leadership necessary to thrive as productive and responsible citizens. Athletics play a vital role in student success, promoting physical and mental well-being while developing essential life skills like teamwork, leadership, and resilience that benefit students far beyond high school. The Montgomery ISD Coaches Show is fueled by EAG Automotive, East Texas's MVP since 1977. With 8 locations and a winning lineup of new and pre-owned rides, they bring the heat with hometown hustle and high-performance service. EAG Automotive, where East Texas drives to win.
With 60,000 fiber route miles across 20 states, we deliver reliable solutions. We prioritize customer service to build better relationships and a better Texas. Consolidated Communications. Let's build a better network.
All right, everybody, join me in welcoming Dr. Brett Kramer from the Woodlands Behavioral Health and Wellness Center. Dr. Kramer, welcome.
Yeah, thank you, Chris. I have to say, I've really been looking forward to coming on. Everyone at the Woodlands Behavioral Health and Wellness Center, we're big fans of the Montgomery ISD program. So I know they're all waiting to listen to this and excited for it as well. Go
Nice.
Bears, go Lions.
I love that. So I like to start with your background. Tell me where you grew up and maybe the transformation, how you got involved in psychiatry and ended up in Montgomery.
Yeah, absolutely. Yeah. I would say, specifically as per my reason for being on this show, I was a student athlete myself, all the way up from grade school to high school. Things like swimming, tennis, lacrosse. So I really understand, when you're at the high school level, especially, you're juggling all these different demands coming at you at once. So be able to serve a small role in helping ease the anxiety of the student athletes that I see, I think it goes really a long way, and it's really rewarding. Specifically coming down to the Woodlands, I've been in Texas for about 2.5 years at this point, coming in from Dallas. I know sometimes there's what we call a contentious relationship between Dallas and Houston, so I don't want to get into that. But I like to say the Woodlands has been treating me very well so far. Beautiful place and very kind people.
Yeah, no doubt, no doubt. And talk about your journey to choosing psychiatry.
Yeah, absolutely. So I think my experience is a little different than a lot of people who choose their specialty in medical school. I had a best friend in high school who actually suffered a serious mental illness. And ever since that point, it really inspired me to learn more about it so that I could help individuals like him. So really, at the end of the day, it wasn't really a question for me. Day one, I kind of knew what specialty I wanted to go into. And I have to say, I love it, right? I love helping people. Especially when maybe they're coming to the office and they feel like a little unsure about mental health care, just making them feel comfortable. That's step number one, right?
Yeah, definitely. So let's talk about it as it relates to students, 7th grade through 12th grade. What are some of the issues that you come across that students face and the pressures?
Yeah, sure. Pressure is a great word for it, especially today when they have time demands as it comes to extracurriculars like sports. You have your school demands. Now you have your friend demands, family, social media. Like, how does anyone will manage this, right? Especially when you're developing your coping skills from 7th to 12th grade. So I really like to understand, first of all, like, what are they dealing with on their plate, right? What is most important to them as it comes to their own mental health journey? And my second real point that I want to figure out is how are they interacting not only with their community, with their family, with their little social ecosystem, but also how are they viewing themselves, right? Where are they coming from? What is their self-esteem? So I would like to say in general, it's really more of like a holistic standpoint instead of
Mhm.
strictly a medical background. And I would say one great thing about the Woodlands Behavioral Health and Wellness Center is we have a complimentary consult liaison, Cindy Andrews, and she does a really great job of understanding what specific services our patients need and to send them there at that point.
Excellent. And talk to me about some of those specific things they run into. And we you touched on the pressures of being an athlete, being a student, and the time pressures, but are there things like, I guess, both sides of the bullying equation too is something.
Yeah, yeah, absolutely. I would say at the end of the day, bullying has changed form since you or I have been to
Yeah.
school.
Yeah.
If you dealt with something at school, it usually ended there. But now you're never really leaving your social circle because of social media.
Mhm.
So the fact that, that unkind behavior can travel throughout everywhere where you're currently physically located can be a lot for anyone to handle, but especially individuals who are just learning their own self identity or their own self concept, right? So I like to teach these types of individuals, student athletes, etc. How do you block out all this noise, right?
Mhm.
How do you block out all these other people who have expectations or opinions of you? And how do you really stay true to yourself, right? And there are certain skills that you can concretely use throughout the day that can kind of bring you back to reality, bring you back to the present moment instead of always being worried about what is everyone else saying or thinking.
Right. And then on the flip side of that is, like the person doing the bullying, we see them as a caricature of this mean person who picks on people, but oftentimes it seems some people may not realize they're bullying.
Yeah, absolutely. Thank you for bringing that up. I think sometimes we're really looking at like the immediate action as per the person bullying or treating someone else unkindly, and we're always looking at it from one dimension. But you're right, the person who is actually engaging in the unkind behavior, what's going on, not only in their own home life, but in their own head that's leading them to act out that way, right? And there's multiple reasons that go even beyond this podcast that I could
Mhm.
discuss about specific causes that could lead to someone acting that way. But a common reason I see that would lead to that type of unkind behavior is anxiety. When a teenager is acting irritable, unkind, annoyed, right? Oftentimes they can't modulate their own anxiety and arousal level, and it comes across explosive, right? And when you're mixing things in like ADHD, sleep problems, maybe even depression, right? It just all compounds on top of each other. That's why I really feel like the Woodlands Behavioral Health and Wellness Center, we really focus on a detailed evaluation. That could be a clinical interview or a psychological assessment. That could be more of your typical like pen and paper assessment to really get to the core of like why this individual, usually teenagers at our clinic, are acting
Mhm.
in this specific way, and how can we actually help them instead of coming in, kind of a shotgun approach of trying to target all these different things when we actually are missing the real cause of the problem.
Right. And I realize it's not one size fits all as far as what you do because everybody's situation is different. But in general, how does your team interact with these students and what does that look like for the student?
Yeah, I mean, I would say that's another highlight of our clinic. We have multiple different types of mental health professionals under one roof, and we really all work together collaboratively so that we really can provide a whole person approach instead of
Mhm.
just targeting specific symptoms. And those individuals make up licensed practical counselors, so your traditional therapists, you have psychiatrists and medical doctors such as myself, and you also have PhD psychologists who are able to perform detailed diagnostic evaluations to really get to the core of the problem, which are very useful for the therapy and the medication management side. And often, I'll tell you, it really takes the whole team to target the actual root issue of why they came in. That's why having multiple different types of mental health professionals involved is really key to making sure that your child gets the best care possible.
Love that. And talk about when an athlete does come to you for their issue. What does that look like for them? What's the process that the athlete goes through from walking in the door totally wide-eyed, not sure what's going to happen, to they have a plan?
Yeah, yeah. I mean, I can understand, especially if you haven't had any experience in the mental health sphere before. It can be intimidating to come to day number one and not really understanding what to expect. That's why Cindy is so great at detailing out on day number one when you come to the clinic. Who are you really going to be seeing? What type of professional are there? What things should you bring in as far as medical records are concerned? And like you said before, Chris, it isn't one size fit all as far as like why they're coming to us in the first place. But we do have specific expertise in student athlete mental health as far as, okay, not only is your demand from the student athlete side causing some type of mental issue, but also, let's say you're at a baseline where you're doing okay, right? And you don't have any like traditional diagnoses like depression or anxiety that are holding you back. We can also take you from your normal baseline level and bring it up a level as well. How can we get you to a stronger performance? How can we get you to a peak performance, right? And there are multiple therapeutic techniques that I think you can utilize at that point. I would say one underrated therapeutic technique that I like to talk about is having goals. And
Mhm.
goals is like a broad, like simplistic term that I think a lot of people can just assume, okay, like you create a goal and you reach it. But there are multiple types of goals that student athletes can use to motivate themselves and be more accountable for their personal growth rather than everyone else's expectations of them.
Right, right. And back in my day, mental health was seen quite differently than it is now, and there was some a certain stigma to being involved in it. So how has that changed, and how is it much more acceptable nowadays?
Yeah, yeah, I gotta tell you, Chris, I think the younger generation is ahead of us in
Yeah.
some key ways, and this is definitely one of them. The patients I see, the younger patients, right, who are either in grade school or high school, the stigma is much less comparatively to what it was in our generations.
Hmm.
And I think part of that is just openly talking about it. They're very open to going to their friends for support. And that's great, right? Sometimes it's all it needs, right? It's a good friend to lean on. But
Yeah.
sometimes you also need a higher level of a mental health professional to come in to really give you that extra care that you might need, even beyond just like simple family or friend conversation. I would say the most common diagnosis that's talked about right now, very hot topic, is ADHD.
Mm.
I think that's because people are starting to realize that, okay, yes, like I may be reaching like a certain level as far as my school performance, as far as my athletic performance. But after I get to the next level, right, whether that's from like middle school to high school or high school to collegiate level, right, I'm really struggling where I used to be able to get through this very easily. And we see that with particularly talented individuals like athletes, like high achieving academic students, where they have ADHD and their natural talent pulls them through the lower levels. But
Hmm.
with the higher level demands, now their ADHD symptoms are actually interfering with their performance. So I see that all the time, whether at high school or collegiate level. And I'll tell you, that's one of my favorite diagnoses to treat ADHD because it's so successful, not only with therapy, but medication management as well.
No, I love that. And I'm glad you brought up ADHD. I was diagnosed ADHD as a 50 plus year old. And finally it all made sense, right? Because like you said, way ahead of the class at a certain level, and then eventually class got boring to me and all that. But I have since seen that as a superpower, if you can channel it correctly. So is that kind of the view that y'all take on it, or is that just me justifying, hey, I'm not sick?
Yeah, yeah. First of all, I would like to say It is not uncommon at all for families to bring their child with them for an ADHD evaluation.
Mm-hmm.
And when I'm actually asking the questions that go under the symptoms to diagnose ADHD, they're doing a mental checklist as well. And they're like, yes to that, check to that, right? And they're going down the list. And we know that ADHD is highly inheritable from a genetic standpoint. So I can't tell you how many parents I treat of when they originally brought their child for ADHD. Now I'm treating their ADHD as well. It's a whole family affair, I like to call it. As far as, the strength of ADHD, there are plenty of strength of individuals with ADHD. Their ability to be creative and make associations between often two unrelated things we know is greater than individuals without ADHD. We know that they're able to split their attention where they can integrate multiple different things compared to people without ADHD. Often people who are very successful have come out with ADHD, including yourself, I would like to say. So yes, there are multiple things that people can use as far as their strength-based approach, where it's not just looking at it from like a deficit, right? You can use the strengths of your ADHD to be highly successful, like many other individuals.
I love that. I love that. And I see here you also do life coaching. And it sounds like kind of what everything is. It kind of falls under that category of life coaching. How do how do the students use that program or those services to help them as a student, as an athlete, and even beyond high school?
Mm-hmm. Yeah, we have a college readiness program that really takes a look at, okay, what are some transition stages that someone going from high school to the college level has, where there's certain skills that have to be developed to get to that point to be successful. And we really go into it as far as like, we can meet you where you are. Do you need someone to look at your college essay? Do you need some organization management? Do you need to reconcile, okay, now I'm out of the house. What type of relationship am I going to have with my family now that I'm not immediately living with them? And that could be a hard transition within itself, especially if they're going farther away from college, as you could imagine, with the family support. So I think at the end of the day, what's the most important thing I could say during this interview is start early, right? Don't wait until your child or yourself are struggling where things have gotten really bad. If you start sooner, like let's say even sophomore year, where you're really developing the skills that a student needs to be successful once they go to college, we can help with that, right? Schedule an initial appointment. We'll go over specifically what we offer. But let me tell you, I've seen individuals with severe ADHD get into Rice University, get into Rutgers University, one individual get into Johns Hopkins University. So it is very much reachable, but let's help you get to that point where you can do the best that you can possibly do.
I love that. And let's talk about injuries. When athletes have injuries, sometimes their moods change, their frustration level changes, and concussions. That's another thing. Talk about that how kids deal with that, and then how your team helps them deal with that.
Yeah, and there's really two sides to that coin as it comes to injuries. One of them, as you mentioned, is the physical injury side, where it's up to not only the parent, but the actual student athlete as far as how fast they're going to go back into their sport. And sometimes there could be a difference of opinion between the student and the parent, right? Usually the parent being a little more conservative and the student wanting to go right back into it. So oftentimes it really takes a family-centered approach to really bring those two opinions together to get to a more desired outcome. For instance, I have my nephew who had a finger injury from football. And he was like all gun ho, like, I absolutely want to go back. And my sister was like, I don't know, I really want it to heal. And what ended up happening is he was able to go back after a period of orthopedic recovery, physical therapy, occupational therapy, etc. And he did really well. But he had a teammate, and this is what brought my sister such apprehension, who had a knee injury. And he went back too soon, sadly, because he really wanted to get back into the season. It was his senior year, right? He wanted to experience everything that I had to offer, which I completely understand. But because he didn't take that time away to fully rest and recover, that injury ended up debilitating him for a much longer period than it would have been if he actually got the proper medical advice, and really dealt with that before going back. So that's how the mental and the physical aspect usually interact with each other. And I'll say that's especially true for concussions, where, yes, most individuals with concussions, they don't necessarily need medical intervention. But I'll tell you what, the research even from 10 years ago is very different from the research today. 10 years ago, it was very much the rest, relax, take a break, right? And then after a prolonged period, go enter the field. I'll say now the research is really suggesting, yes, take your time to rest and recover, but we don't want you off the sidelines for too long. Because if you do, then that can create a mental trap where now instead of going immediately back on the field, you start to become anxious because you haven't experienced that specific aspect of the sport in a while. So we see avoidance behavior there, where they're really avoiding what they love to do in the first place when they initially got injured. So at the end of the day, I think it's important to realize that the sooner you recognize these types of problems, the better it is to actually get that treated and to get help, so you're not causing long-lasting impacts down the line.
Nice. And specifically in that, you mentioned being on the sideline. Are you differentiating the sideline from in the game, be at the atmosphere, but not be in the game yet?
Yeah. Thank you for pointing that out, Chris. The mind and the brain are really good at making associations, right? So if you're not on the field at all, right, you're really separating yourself mentally from the sport that you engaged in before the injury. But even just being on the sidelines, being with your friends, being with your teammates, right, that's a huge part of the psychological recovery when you're coming back from an injury. So I would say as soon as possible, right? And again, this is very individual based. Just getting you back on the sideline with your teammates is really, really crucial and very important. And the next step may be, you come for a practice and you're under restricted guidance under an athletic director or a physician, and then you fully progress back to full play. But the most important thing is you're not staying away from the atmosphere, the sport that you love, the friends that you love, your teammates.
Got it. Got it. Yeah, that sounds extremely healthy. You're right. It's far different than 10 years ago, far different than my era when they were like, when you can see straight, get back in the game.
Yeah, exactly. And I think there's also a lot of subtle signs of concussions where it really should make someone question, does this need a higher level of clinical care? For instance, at our center, we look at key symptoms that indicate that some type of mental health support would be useful. Off the top of my head, I can say the most common symptoms that need intervention include increase in irritability or agitation, anxiety, personality changes, sleep difficulties, and that avoidance behavior that I talked about before, and even cognitive symptoms like decreased concentration, decreased memory. Even if you're 2 weeks back from the concussion, you really should see those types of skills come back fairly quickly.
Got it. Got it. And talking about the next level, college, the students, many of them have big aspirations to go to college and earn their degree. Others want to compete in collegiate athletics. What role does your team play in that? They don't just, high five them out the door once you graduated from high school, correct?
Yeah, no, absolutely not. I would say, you have multiple considerations when you're going to the next level or you're considering the next level. I think the reality that, students have trouble accepting is most individuals won't go on to the collegiate level, right? So they're engaged in these sports that they're very passionate about. They're practicing 6, even sometimes 7 days a week. And this is all they've done as far as being with their friends from grade school all the way up to senior year high school. So to make that decision and to reconcile, okay, well, if I'm not going to be engaged in this sport on a daily basis, how else can I form my identity and my personality? That can be a tough transition, right?
Mhm.
That's where that life coaching, that therapy aspect can be especially helpful. I'll say student athletes who are transitioning onto the collegiate level, that's where the sports psychology concepts come into play, that mental training concept, where it's okay, you were at this level and you had these expectations, but now it's up to here. And how do we get you up to there, right? Goals is a way to do that. Also, anxiety management. So you really have a spectrum where if you're not challenged enough, right, and your skill levels are too high, then you're not going to be close to peak performance, right? Everyone knows playing tennis, right? If your opponent really is just a beginner and they don't have the skills, right, you're not going to be playing at the level that you're used to.
Mhm.
Now you have the other extreme side where you're too stimulated, right? You're too anxious, you're too hyped up. And we know that can really, really interfere with the muscle memory that you've gained in your practice. And you're not able to implement the plays that you've, really rehearsed again and again in your mind during those practice periods. And then you have the middle, right? Whereas you're stimulated, you're challenged, but you have the skill level to reach that point, right? And we call that the flow state or being in the zone. A lot of athletes will even talk about time almost stopping around them, when they're making that throw, when they're making that touchdown. And sometimes it takes specific psychological techniques like imagery, like progressive muscle relaxation to get you into that flow state if you're too far over to the overstimulated point.
Nice, nice. And how does a student know when they should be reaching out to somebody like in your office?
Yeah, yeah. I think at the end of the day, if you feel like, okay, I was at a certain level and I should be progressing to the next level and I'm having trouble, that could be a reason to reach out
Mhm.
because, like I said, there are conditions that are underdiagnosed, such as ADHD being the most common, why you're not getting to that next level. But also at the same time, if you just feel like there are certain mental roadblocks in the way that is preventing you from being at peak performance, we can really get you to the next level. I'll say we have specific athletes going to local programs throughout the state who weren't sure, would they be on the bench or would they be actively playing? And after our specific mental training program, we were able to get them to the level where they've been on the field.
Nice, nice. And talk about beyond there in the office, talking with your staff. What are other ways that I guess that you provide services to help them with their peak performance when we're not in, one-on-one office meetings?
Sure. I think, like I said before, using these specific techniques that you learn in the office and like the real world environment is the most important aspect to therapy progress at all, whether it be for student athletic performance or otherwise. So that's why we don't just like, okay, these are the techniques, go out and do it, right? Because that's
Right.
never going to work, right? We do it with you over and over again so when you are in those moments that are taking you out of your peak performance zone, like I talked about before, where
Mhm.
your level is there as far as your ability to play, but you're just overstimulated, you know exactly what to do because I've done it with you multiple times to
Yeah.
get back into that flow state. So practice, practice, practice. That goes not only for the physical aspect, in the weight room, but I like to use an analogy for students that when you're walking into my office, this is the mental weight room, right? And we're
Yeah.
going to go over and over it until you can do it in your sleep.
Yeah, so you teach, you demonstrate, and they take that with them. Are there other resources that they have available to them?
Yeah, absolutely. I would say specifically resources as regards to out of the office. We often give them physical imagery tools that will put them into a state where they're able to reach basically the previous ideal peak performance. So what I mean by that, so if they were successful, let's say in two prior games, then I really want them to be able to capture that success. So I work with athletes to be able to imagine not only the physical state that they were in at that moment, but how about the emotional state that they were in? How about the mental state that they were in at that moment, right? And if they can capture when they were successful two games before, then they could capture that success again. And that's how we like continue to build off success to get them to that peak performance that they're really looking for.
Excellent. And so for people who want to reach out and find out more, maybe take an assessment, how can they reach you? Give me some phone, website address, physical address.
Yeah, absolutely. Well, you can easily find us right on 2700 Research Forest Road. We're right next to the Woodlands Mall. And you could specifically call us at 281-528-4226. That way you can contact our complimentary consultant specialist. And she's really great where she'll ask you questions that can really target you to the type of treatment that you need. For instance, therapists, psychological assessments, and even meeting with a medical doctor like myself for a psychiatric assessment.
Excellent. And we'll put all that information in the show notes so that people can reach out to you. Dr. Brett Kramer, gosh, I want to thank you so much for sitting down with me, sharing some really important stuff.
Yeah, absolutely correct. It was a pleasure. And I would like to say, specifically for the student athletes in our community, if you're looking to get to peak performance, right, it's worth a visit to show you what we can offer you because I think you'll be welcomely surprised.
Hey Coach, Lone Star Gridiron has been the leader in Coaches Show podcasts for 20 years, and now you can get your own Coaches Show podcast each week during the season as a fundraiser for your booster club. Yes, booster clubs all over are using these podcasts to help their sports programs. You get to share the stories of your program and your kids to a huge audience and make money. We started with just football, but this year have expanded to make them available for all sports. Call 713-269-4620 to find out the details and get your Coaches Show started.